More than 3.6 million people infected, over 250,000 dead, and the fatalities continue to rise even as we speak. The spread of COVID-19 has been relentless, and the reach is astounding. It has affected more than 200 countries in a span of just a few months.
A virus that transmits so effectively, it has managed to exploit the way we live so close together in highly urbanized societies, and now to pose an existential threat to the human species.
Public healthcare systems have been stretched to the limit, and healthcare workers are suffering from mental stress and physical exhaustion due to the pandemic.
We feel alone, we feel vulnerable, we feel expendable.
More than 3.9 billion people, or half the world's population, are living under a lockdown. Work, school, places of worship, almost everything and anything social have closed as people hunker down, staying indoors, scared and anxious. But instead of mounting a collective response to defeat a common enemy, two of the world's leading economies are at loggerheads with each other.
Two domestic realities alongside a trade war between the two biggest economies in the world is why we have a pandemic the way that we have a pandemic right now.
Is the US paying the price for its delayed response? Or is it the absence of a united global leadership that caused the pandemic to spiral out of control? And what impact does that have on frontline workers who are fighting to keep the disease at bay? The COVID-19 virus first reared its ugly head in December 2019 in one city, Wuhan, in central China. In just a few months, the outbreak has morphed into a global pandemic. It has swept across the world like wildfire, burning through many countries in Asia, Europe, North America, Africa, and the Middle East. From the Northern Hemisphere to the Southern Hemisphere, no country has been spared. Since the first COVID-19 case was reported, it took 67 days, or about 2 months, for the number of reported infections to reach 100,000. But it took just a few days for the numbers to jump fourfold.
This virus has turned out to spread more easily than what initially we thought it would. Because this virus is now spread so much and so fast around the world, I think it's almost impossible to get rid of this virus in the same way that we got rid of SARS, right? I think this virus has now a strong foothold in the human population.
The epicenters of the outbreak has repeatedly shifted with ferocious velocity. From the original outbreak in Wuhan in December 2019, the epidemic then spread to all of China's 31 provinces by the end of January 2020, before expanding its presence in more than 20 countries across Asia, Europe, and North America. On March 9th, Italy took over from China as the new coronavirus epicenter, with much higher rates of infection and death. It then raged across the European continent, forcing all states in the European Union to shut their borders to each other in a desperate attempt to stem the tidal wave of infections. While most nations began to lock down workplaces, schools, and social gatherings, the UK government adopted a risky strategy that caused a public uproar. Instead of imposing a ban on social gatherings, it attempted to build a herd immunity within its population.
In UK and now even talk in Sweden and Netherlands that they're trying to create or generate this herd immunity by letting the virus spread through the population. Theoretically, it can be done. Practically, it's almost impossible because you cannot control that spread, right? So for places where they've not been very tight in controlling the virus, then they get an overwhelming number of cases, and that then creates this excess in mortality. So because we cannot control the spread of the virus, then herd immunity is by natural infection is a very dangerous thing to pursue.
With mathematical modeling of disease projections, it was estimated that the herd immunity strategy could lead to 1 million deaths and another 8 million requiring critical care support. The idea was quickly abandoned, and the UK government did an abrupt U-turn. In an ironic twist of fate, UK Prime Minister Boris Johnson himself fell prey to Covid-19. He has since been discharged from hospital and back to running the country. After burning through Europe, Covid-19's destructive tide was turning towards another continent. From Italy, the epicenter of the outbreak then shifted to the United States. By March 26, the US had the most number of infections in the world. Was the US caught unprepared?
Yes, to put it bluntly, the US was unprepared for it. I think they held on to a very optimistic view that this was an Asian problem, that it wouldn't reach them. That unfortunately, even when it got to Europe, they still held that view, and I think that then delayed the preparations. They weren't ready for the surge in the cases. They weren't ready to test for those infected with the virus and isolate them.
Even as the novel coronavirus epidemic was playing out with deadly consequences in China by mid-January, US President Donald Trump's response was dismissive, simply assuring the American public that he had the situation under control.
In societies where there wasn't great belief that this virus posed the level of threat we know it does pose, where that happened, it may well have been a difficult sell to commit a lot of resources, a lot of human resources, to teams doing testing, to teams doing surveillance.
That was one of the key pieces that said it. He was in the middle of an election, and in the middle of a US election is a bad time to have a pandemic because every political incentive he had was to have good news. The second was the entire narrative of the Trump administration has been focused on two things. One, keeping out foreigners and border control, and two, how great the economy is. Well, this pandemic is bad news on both fronts.
In US, they have missed the golden opportunity to do a better job in February. And it's mainly their incompetence. And if they did a much better job in February, then it will not be like what it is today. They don't feel like that it will cause a major outbreak in US at some point. They kind of felt that it is a problem of China, it's a problem of somebody else, and not a problem of US.
And soon the number of infections and deaths began to climb, from just one death on February 29th to more than 70,000 deaths today, from just 70 infections on February 29th to over 1.2 million cases just 3 months later. Michelle Gutierrez is a registered nurse in California. It was in mid-January when she read a few online stories about the outbreak in Wuhan. Even back then, she couldn't help feeling that something bad was going to happen.
I started emailing our executive director and our research people and the National Nurses United, both and for my employer at Kaiser, to that this was something we should really look into, because it was only a few days before the Lunar New Year, Chinese New Year, and where I work, we have a large population of Asian Americans who travel to China for Chinese New Year every year. So that was a huge concern for us.
Much to her dismay, there was a total lack of response from the US Center for Disease Control and Prevention, or the CDC, to the outbreak in China.
It took so long for CDC to change their criteria back then, how to identify COVID suspects. And, all the way up to February 28th, they didn't change their CDC guidelines to identify everybody that traveled outside of the country who were having fever, shortness of breath, or cough. Back then, it was only people who traveled to Wuhan who had these symptoms, and they were coming in and they had a multitude of symptoms, and sometimes not all symptoms. Sometimes they had fever, sometimes they didn't. Sometimes they had coughing, sometimes they didn't. And it was nerve-wracking because the hospitals and the clinics were following CDC guidelines once again. And the problem with that is if they did not fall under the criteria of the CDC, then our isolation precautions and our infection control precautions did not kick in to wear the actual appropriate PPE, which left us then vulnerable.
For a country that prides itself on being a global leader in science, technology, and innovation, it was baffling to see how the US has been caught flat-footed, even in the midst of a tragedy that was unfolding in Asia and Europe.
The CDC failed in its efforts to deploy a test, and that is remarkable to me. I don't really know why that happened at the degree to which it did, but our failure to mobilize all the rest of the resources within the US healthcare system was because it was so decentralized and so privatized. There wasn't a way to move forward. The US in its early response clearly focused on the political frame of keeping a foreign virus out. The president talked a lot about this being a Chinese virus, and so the focus was really on border measures and border closures and banning certain people from coming to the country.
According to a report in the New York Times, US President Donald Trump had already been warned by the intelligence community and health officials about an impending pandemic. But he had sought to play it down to help protect his economic gains.
Well, I think the US government, the presidency was slow to react at the beginning. We recall that, he was saying things like it was a hoax, and that after that, things were under control. So there was a bit of complacency. Unfortunately, the nature of these crises is that if you lose time at the very beginning, playing catch up, as we have seen, has proven to be really very difficult for the United States.
Now that we're seeing the beginning of testing ramping up, we're seeing that kind of capacity, the millions of tests starting to roll out. Had that happened starting in mid-January, when we knew that there was the beginning of an outbreak, we would be in a very different place than we are right now.
As the number of infections continued to rise exponentially, Mr. Trump then turned his guns on the World Health Organization, or WHO, blaming the world body for the escalating outbreak in the US.
These sort of accusations, is finger pointing from any country, serves as a distraction, and it's a distraction that we should all nobody needs. It's harmful to the work we need to do to fight this virus. I think my Director General said it best: quarantine the politicization of this virus. If you politicize the virus, if you create these distractions, you create cracks, a chasm that the virus exploits. So the terrible danger of distracting your energy, not focusing on the work that needs to be done, is that you give the virus more opportunity to do more harm. And we've seen what terrible ravages it does, how it's wreaking havoc in our societies.
America's withdrawal of funding to the WHO, however, appears to have played into the hands of China. It now sees the COVID-19 situation as an opportunity to assert itself onto the global stage. But can China be absolved of all blame? There remains skepticism over the data and numbers coming out of China. Are such criticisms valid, or will detractors say anti-China reports are politically motivated? Insight explores the US-China blame game after the break. As the deadly COVID-19 pandemic continues to plague all nations and decimate the human population, the world's two leading powers, the US and China, are embroiled in a destructive blame game. US President Donald Trump has accused China of being responsible for the novel coronavirus outbreak. He even warned China of possible consequences if Beijing is knowingly responsible for the pandemic. Mr. Trump has kept insisting that the number of deaths in China is far higher than the US, even though official figures show that US death toll is 7 times higher. The threat was made after China revised its death toll from COVID-19 upwards by almost 50% to 4,692. China has attributed the mistake in its early reports to an overwhelmed healthcare system during the height of the crisis, but dismissed claims of a cover-up.
The bottom line is we don't actually have a good picture about what has actually happened in China, because I think many of us are deeply distrustful of whether the numbers coming out of China are accurate. Now, I will say that I don't think that some of the other numbers projected out of China from US intelligence agencies are accurate either. What we're seeing is a very political set of machinations over what the numbers are. But without good information, without good numbers out of China, it's very hard to tell what worked and what didn't.
At the start of the outbreak, Mr. Trump had repeatedly called the coronavirus a Chinese virus, despite criticism that the remark was racist in nature and would encourage xenophobia. China's foreign ministry in response tweeted an unsubstantiated claim that it was the US Army that brought the coronavirus to Wuhan during a joint military exercise in October.
There is a presidential election coming up. I think that the current president is under a lot of pressure. I mean, the anchor of his re-election campaign was always going to be the economy, okay, and that is going to take a big hit with this virus. So now he's grasping at straws to some extent as to what hook he can rely on for his campaign. One obvious one is to shift the blame to China, which they are obviously doing.
To date, the US has over 1.2 million infections and more than 70,000 deaths, and the numbers are rising rapidly every day. But it's an entirely different story in China. Officially, China has reported some 83,000 COVID-19 infections and the death toll of over 4,600. New cases of infection are in the double digits and deaths from COVID-19 are in single digits. Has China really turned a corner in its battle against the pandemic?
Now, China's facing several major problems. One is, have they actually shut down transmission? We don't know whether or not to believe that there are no transmissions happening in big parts of China, because there's not a lot of insight there, and there's a lot of distrust about whether the numbers are actually politically motivated.
China has come under heavy criticism for allegedly trying to suppress information relating to the outbreak in Wuhan in early December last year. For example, when Dr. Li Wenliang, one of the doctors in Wuhan who warned about the emergence of a SARS-like virus spreading in the city on social media, he was reprimanded by the police for his action. His death from the virus 2 months later had prompted an outpouring of grief and anger at the government's handling of the crisis.
What happened early in the pandemic, where we didn't see early reporting and we didn't see movements from the ground to report up the outbreak when it happened, because there was every incentive to not report bad news to the leadership.
Still, it doesn't alter the fact that China had acted swiftly to put the disease under control.
Even if it is underreporting, it is a fundamental error, but it might not be fatal because, it does not change the fact that the outbreak has been put under control.
I got to say that what China did with controlling the outbreak has been truly remarkable, and it should serve as an inspiration for all that it can be done.
After nearly 3 months of lockdown, life in Wuhan, the city that has become the potent symbol of the outbreak, is now slowly returning to normal. The quarantine that was imposed on January 23rd has now been lifted as the epidemic situation appears to have eased. For 42-year-old Zhang Li, who lives with her husband and 16-year-old son in Wuhan, the news was greeted with a huge sense of joy and relief. They could now enjoy all the things that they took often for granted, even a simple thing like taking a stroll down the street. Although the fear is gone now, she still can't forget the long days and nights when she felt that the end was near.
我是1月20日的时候知道了武汉有这个新冠病毒在蔓延。当时所有的人出去的话都是会佩戴口罩的。我压根都没有想到我会得上这个病毒，因为我的生活轨迹非常简单，就是上班、下班、回家，接送孩子上下学。应该觉得自己应该不会被感染的。但是1月24号除夕的那一天，我上了一个夜班，回去了以后就开始低烧，就是37度5、38度这个样子。吃了泰洛以后，它可以退烧，但是会马上就会再烧起来。连续烧了2天以后，我先觉得应该是只是普通的感冒，应该没什么问题。我的身体素质一向来说还是挺好的，但是我的父母觉得这个长时间的已经烧了2天都不退烧的话，但是拿到 CT 的片子的时候，看到结果的时候，感觉就是五雷轰顶，上面显示的是病毒性肺炎。我当时的感觉就是完了，中招了。我基本上就是带着哭腔给我老公打的电话。我老公说：“你先别急，也许不是这个病呢。”
But her husband's optimism was proven wrong. Miss Zhang had tested positive for the coronavirus, and that day marked the beginning of a lonely and uncertain journey to recovery.
我记得当时有一幕让我真的非常震惊，一个70多岁的老人，颤颤巍巍的走了过来，直挺挺的就倒了下来。当时没有一个人敢过去扶他，马上就有医护人员把那位老人抬起来送走了。当时的心情非常的恐慌，我都不知道我会不会有可能就这样站着倒下去，以后就再也醒不过来了。每天要照顾自己的日常生活，还要跟病魔做斗争。那个时候人没有任何的味觉，也没有什么胃口，但是我会强迫我自己一定每天3餐都要吃。
But days later, her health condition began to improve, and on March 16, 10 days after living under isolation, she was discharged from the hospital and given a clean bill of health.
我3月16号出的隔离点，当时的心情非常的激动，因为我知道，我的抗疫即将取得胜利，而且我也可以回家了。我记得是到了下午3点钟的时候，我们社区派了专车来接我，把我送到社区的时候，我们社区的网格员 他们对我都非常的热情，没有任何的歧视。
Medical experts across the divide agree, despite some misgivings over China's reported numbers of deaths and infections, China has managed and effectively brought down the first wave of the epidemic on the mainland.
So the turnaround was really in mid-February, some weeks after the lockdown was imposed in Wuhan, late February, I should say. But we certainly did see, if you look at a graph, you will see the lockdown. Initially, the cases are still going right up, but a couple of weeks after, they really begin to come down. So, and by March, we were beginning to see very, very convincing evidence that the outbreak was coming under control.
The US, however, is still fighting a huge battle. Mr. Trump is eager to reopen the country. State governors, however, are divided along party lines. Blue states with Democratic governors like New York are resisting any federal force to prematurely lift quarantine measures, while red states or Republican governors such as Texas and Michigan support the president's message. Beyond the physical deaths and critical care for infected patients, what long-term consequences will there be on the psychological impact of COVID-19? As COVID-19 tightens its grip around the world, the war against the deadly virus has now caused divisions among nations. Instead of working together to defeat a common enemy, it has deepened the gulf between the United States and China. Even though more than 3 million have been infected and some 250,000 deaths so far, the geopolitical rivalry between the two global powers continues unabated. And that has led to an absence of global leadership and a collective response to the pandemic.
Yes, I think certainly there is an element of that there, the lack of trust. I mean, we have to understand that the narrative or the discourse of US-China diplomacy has become so acrimonious, over the last year and a half, that it is it will take a lot to step back from that. It will take leadership to step back from that and try to find some common ground and commonality in terms of how to deal with a crisis that both countries are confronted with.
The United States, which had been the indispensable country, had been the leader, had been the convener, had been the giver of aid, did not step up, did not play that role internationally. Meanwhile, several other countries stepped into the breach, including China. When we watch China move its politics, its foreign policy, aggressively towards supporting other countries, whether it's Italy or countries in China like Ethiopia that have recently gotten major contributions, or work in other parts of Asia, China's trying to play the role and repeating some of the moves that geopolitically the United States has played.
As a result of this great power rivalry, the world was caught unprepared to robustly deal and respond to the emergence of the deadly outbreak.
At this point in time of the bilateral relationship, in fact, it just gets more and more acrimonious. They're ramping up the tension in that respect. So such a situation makes it very difficult for the leaders to trust each other, to be able to sort of play down that kind of rhetoric in search for more common cause.
And that has taken its toll on healthcare workers. Many of the frontliners are suffering from psychological and mental health problems in their valiant efforts to save lives and keep the pandemic under control. Michelle Gutierrez is on the front lines of the COVID-19 fight. She feels particularly helpless and vulnerable in the face of ongoing threat, especially when there's not enough protection being extended to people like her.
The nurses, by virtue of our role, we're always prepared. No matter where you send us, disaster relief or everyday care, or somebody's crashing in the sidewalk. We're always prepared, but it's a different matter when our employers are not prepared and our government is not prepared. And we're going in there into the battlefield and the trenches every day without the appropriate protective equipment and the appropriate tools to not only protect us, but protect all of our patients that we serve on that day. We are not protected. In seeing that one patient and we were infected, we would have infected all of the patients and their families that we saw for the day. Not to mention all of our coworkers that, we work with every single day. It's frustrating. It's really frustrating as a nurse, as a mother. We do not feel protected. We do not feel supported.
Not only are they potentially exposed to infection, the higher patient caseload is also causing tremendous physical strain and emotional stress, leaving them more exhausted and susceptible to illness, and even to longer-term consequences of post-traumatic stress disorder.
It's unconscionable and it is immoral. And, we're very strong by virtue of our role. We are healers. And even that affects us emotionally, mentally, physically. As I talked about earlier, I'm sure there's long-term effects and PTSD of what we're going through right now. It can't possibly be healthy, to go in somewhere, to go into work every day for 8, 10, 14, 16 hours.
I have seen photos of my classmates with pressure sores from wearing that mask for so long and their PPE, and it's tough on them, and they also have kids at home and they're very worried about bringing this back to their kids if they do get infected. And it is a risk that they willingly take, but it doesn't mean that they don't have these feelings of anxiety and they don't have these feelings of fear when it comes to going to work.
Across the world, frontline doctors and nurses have tragically lost their own lives to COVID-19, even as they try to save those struck by the very same virus. From China to the US, Europe and Southeast Asia, the virus does not respect national borders.
We've seen healthcare workers, both in other countries and in the UK, who have died as a result of contracting it from their patients. So that really focuses people's mind. It makes, adds, I think, a degree of nervousness, and particularly for those members of staff who are a little bit older and may also have chronic health problems, it's a very material risk which they are understandably concerned about.
The COVID-19 pandemic has also triggered exceptional and unusual psychological burden on healthcare workers. All over the world, hospitals have been overwhelmed by the outbreak. There are not enough surgical masks, personal protection equipment or PPE, ventilators, or even hospital beds.
No matter how many millions of masks and PPE that these politicians and these agencies are saying that they're procuring, it's not getting to us in the front lines. It's locked up somewhere in a manager's office. And this is across the board in all hospital systems, in all the clinics. They're hoarding. We don't know where these supplies are. They're certainly not getting into our hands.
And the severe shortage inevitably has led to the heart-wrenching ethical dilemma of rationing the scarce healthcare. In a situation where you can't save everybody, who do you save?
If you have limited resource, then you basically have to now decide where to use your resource, and you would use it on those who can benefit from resource versus those who probably, despite your noblest and best interventions, will likely die. A lot of these decisions are having to be made by doctors who are caring for those patients, or sometimes by patients themselves and saying that, I've lived a long life, you can give this machine to someone else. Those are tough decisions to make.
In terms of the ethical decisions of not being able to do anything, if you're faced with a case where there's nothing you can do, of course you're going to go home and think about that person and what could you have done? Is there anything more you could have done? And those are the sort of factors. Suicide, like I say, is having a sense of hopelessness. And once we get this idea that there's nothing we can do, then that gives us the risk of feeling that there's no point to continue.
Deaths of their colleagues and news of the fate of their fellow professionals weigh heavily on already nervous and burnt-out medical staff. There have been rising reports of healthcare workers in COVID-19 related suicides in the UK and Italy.
Yes, we have seen suicides around the world of healthcare workers who are unable to cope with it, or even that they're worried that they've contracted the virus and they don't want to bring it back to their family.
And it's not only doctors and nurses who are under extreme psychological stress. A German state finance minister, Thomas Schäfer, committed suicide, apparently after becoming deeply worried over how to cope with the economic fallout from COVID-19.
And we have seen, like I pointed out, the German minister who committed suicide because of the crisis that was in front of him, and he had no idea what to do, and that can be a very scary thing. So we are definitely seeing suicides around the world which are linked directly to this pandemic.
And the price the public is paying for the COVID-19 pandemic is huge. The cost of the disease, the burden on the economy, and right down to it, people are struggling. Health, bread and butter issues, mental stress, long-term consequences. What is it going to take for governments to flatten the curve before we can see some kind of normality? And what will the new normal look like after this? One is the world's leading economic superpower. The other is the world's second largest economy and an aspiring global leader. Today, both countries are facing a health crisis of an immense proportion. But while China, the original epicenter of the novel coronavirus outbreak, has been able to put the pandemic under control, the US, under President Donald Trump, is still struggling to contain it. Despite initial reluctance to come clean on early outbreak signs, once the Chinese did respond to COVID-19 outbreak, it was swift and decisive. The US, on the other hand, was slow off the mark. For example, on January 22nd, just 3 days before the Chinese New Year, authorities suspended all rail and air links out of Wuhan. The next day, the Chinese government imposed a complete lockdown of the bustling city of 11 million people to prevent the virus from spreading to other major cities. Conversely, the US detected the first COVID-19 patient on January 21st. President Trump greeted the news with a tweet, assuring the nation that the situation was totally under control and it was going to be just fine. 2 days later, upon learning how damaging the pandemic would have on the lives of American people, he imposed a ban upon arrival on all non-US citizens who had traveled to China. But by then, it was already too late. With no adequate protection, testing facilities and social distancing measures in place, the virus began to spread like wildfire. By March 27, there were more than 100,000 infections. In a matter of 6 days on April 1st, that number soared to more than 200,000. Today, America has the highest number of COVID-19 infections and deaths.
Here in the United States, the thing that has probably surprised me the most is how unprepared the US health system is for this outbreak. The lack of ability to coordinate across states has been remarkable. The insufficient response from the federal government, in particular from the White House, has been remarkable.
On March 14, President Trump announced the stay-home orders to slow down the spread of the virus. Yet, just a month earlier, despite having the highest number of infections and deaths in the world, many Americans came out to oppose the lockdown measures due to the damage these restrictions have done to their livelihoods. Protests have broken out across the country, including in Michigan, Kentucky, Oklahoma, and North Carolina, demanding that the stay-home restrictions be lifted. They also called on the government to reopen the economy. That sentiment is also shared by Mr. Trump. But experts believe opening the economy too soon may prove suicidal to the lives of the American people.
The mild cases are left in the community. And that's a problem because then the virus continues to spread. If things are not implemented carefully and aggressively, then you let this infection spread, then there's a chance that hundreds of thousands of people will die from COVID-19. So will that happen? I think had this gone on like the early days of the COVID-19 outbreak when it started in the US, if they hadn't stepped up, then I think it would have gone on.
The flattening of the curve question is incredibly important, but it's only one part of the diagnosis. We need to not only flatten the curve, but we need to shorten the curve. We need to limit the amount of people who are going to get the virus, not just spread them out. Social distancing gets us a certain way around that, right? Social distancing can help prevent transmission and can help prevent the virus from jumping from person to person, and then doing so quickly and in spikes that overload the health system.
As the world's #1 economy, the US continues to grapple to find a semblance of control in fighting the pandemic, the engines and machines of the world's #2, China, have roared back to life. Hundreds and thousands of workers have begun pouring back into factories across the country, and life is returning to normal again, gradually but surely. Wuhan resident Zhang Li was tested positive for COVID-19 on January 24th and immediately went into quarantine. By March 16, she was given a clean bill of health and was able to return home for the first time in 53 days.
我3月16号出的隔离点，当时的心情非常的激动，因为我知道，我的抗疫即将取得胜利，而且我也可以回家了。我记得是到了下午3点钟的时候，我们社区派了专车来接我，把我送到社区的时候，我们社区的网格员，他们对我都非常的热情，没有任何的歧视，和我一起拖着我的行李把我送到小区楼栋，还送给了我一份新鲜的蔬菜，让我当时非常的感动。
China is now, in many ways, becoming the laboratory for the rest of the world on this, because the rest of the world is watching to see how can you lift the restrictions, the very strong social distancing restrictions, and not risk a reignition of the outbreak. So the very strong actions being taken to ensure that everyone coming into the country and coming into the areas where the outbreak has been ongoing, to ensure that those people are tested and followed, are extremely important measures. And again, this is what we know works.
But even before the dust has settled, the blame game continues unabated. US Secretary of State Mike Pompeo recently said, without evidence, that the coronavirus outbreak originated in a Chinese laboratory. It is a similar charge made by President Trump, despite China's denials. Should the US and China do more to mend the differences? Will their collective action help make a difference in the fight against a common enemy?
You're looking at the US and China, two countries that have the most advanced, both in terms of technology, in terms of scientific knowledge, in terms of research and development environments, two most advanced countries in the world in that respect. And if we were to have any hope of getting a handle on this pandemic, not just containing or managing it as policy, but trying to understand what it's all about, you can't do that without the US and China helping us with the information and with the capabilities that they have.
COVID-19 is a microbe that humanity has never encountered before. A few months have passed since its first outbreak in December last year, but there's still many missing pieces of the puzzle which are holding back medical experts from finding an effective cure for the disease. But it would help take the heavy load off their shoulders if countries, big and small, are all united in their response towards a common threat, instead of allowing politics to cause divisions and rift among nations.
We still haven't figured out what it's all about, how it spreads. Much better if we can develop collectively our pool of knowledge and understanding on that. And I do hope that there will be that realization and that there will be that political will. And even without political will, I do hope that the scientific community, the medical community, are basically saying, forget about these politicians. Let's try to figure out the problems ourselves. If there are channels for them to do that, that would be great.
From trade war to a war against the invisible enemy. Until today, two of the world's great powers remain trapped in a blame game which promises no easy way out, even as the world grapples with the human and economic devastation brought about by the deadly pandemic. If anything, the global competition has only served to impede the fight against a common foe. When will both countries end the blame game, and when can trust be restored? The major rupture in relations between the US and China will only bring about a tragic outcome for the two countries and the world.